Approximately 280 million people in the world suffer from depression. Hi, I'm Dr. David Silbersweig. I'm a neuropsychiatrist and chairman of the Department of Psychiatry at Brigham and Women's Hospital, Harvard Medical School. Clinical depression is more than just despairing thoughts or feeling down. It's a serious medical illness that requires understanding and medical attention. Some of the symptoms of depression include things like thoughts of hopelessness, helplessness, worthlessness, changes in sleep, appetite, or sex drive, loss of energy, lack of concentration, lack of motivation, loss of interest or sense of pleasure in things, changes in movement, physical aches and pains, and even suicidal thoughts. The brain is the organ of the mind. As neuropsychiatrists, we want to take an integrated approach, understanding the brain mechanisms underlying depression and its symptoms. Such an integrated approach wasn't always the case. For thousands of years, people thought that the mind and the body were completely separate and did not understand how it is that thoughts and feelings and perceptions and behaviors could come from an area of the body, such as the brain. In fact, in transition, people for hundreds of years were thinking about things like fluids or humors in the body that had gone awry, causing melancholia. In the mid-20th century, it was discovered certain medications can affect mood. And this was a revolution in that it allowed people to start to understand the ways in which chemistry or neurotransmitters in the brain modulate mental activity. Today, we have many medications that can be tremendously helpful for depression. At the same time, forms of psychotherapy like cognitive behavioral therapy have strong evidence that they can be helpful as well. At Mass General Brigham, we're developing and utilizing advanced brain imaging to map the patterns of brain activity that underlie emotion, thought, and behavior and that are abnormal in depression. We then take these maps and we can use them to guide brain stimulation or neuromodulation techniques such as transcranial magnetic stimulation that non-invasively delivers pulses over the surface of the head and can alter brain activity underneath that supports therapeutic change in depression. We and other centers have been studying how ketamine and psychedelics, with a combination of psychotherapy, may induce neuroplasticity, which is the brain's ability to reorganize itself by forming new neural connections throughout adult life. This could rapidly reverse suicidality. With all these treatments, the ultimate goal is to achieve remission, to get patients back to their lives so that they can live a life that's full and meaningful for them. Thanks for watching. I'm Dr. David Silbersweig. For more mental health videos, click here, and don't forget to subscribe here.